Hello, you're welcome. You're welcome onto my channel today, and it gives me great joy to observe you are viewing this video. I'm Professor Olayinka Akonle. I'm a lecturer in the university. On this channel, I do a number of stuff, but of all I do, sociology and research are very central. You're welcome once again. So this video today is on professional applications of medical sociology. Professional applications of medical sociology. Meanwhile, if you have not subscribed to this channel, kindly go ahead and click subscribe on your screen right now. Tap subscribe button on your screen right now. This is a very important video. Meanwhile, for you to also be able to have absolute understanding of what I've discussed in this video, you need to view two previous videos I've released on medical sociology. They are part 1 and 2. So the part 1 is just about what is medical sociology and what is the relevance of medical sociology, part 1. Then the part 2 is what is medical sociology and what is the relevance of medical sociology, part 2. So this one is like a continuation of the two parts. So I'll be looking at the professional applications and some little other things about medical sociology for the benefit of all my subscribers who have been asking for a continuation. So medical sociology actually has been existing since the 1900s, but it was not until, until 1959 that American Sociological Association officially recognized medical sociology as a subfield of sociology. And another important thing for you to know is that this is the part of sociology that is closest to medicine, is the most practical element of sociology as a degree that is very relevant in the health system. So it's in between sociology and medicine. So if you are a sociologist and you want to practice medicine, then medical sociology is very important. Or you want to move to advanced degree after sociology and you are looking at a medical interface where you can still operate within the clinical system or within the hospital system or the healthcare system. So medical sociology is your best option. Though social work is increasingly becoming appreciated or nearly seen as that element of the social in health. But I think that's actually, is wrong. The closest aspect in terms of social and medicine is medical sociology. In fact, I would prefer to say that social work is just an element, an aspect of medical sociology. So it's a critical aspect of sociology in medicine or in medical system or in health system. So, and it's increasingly evolving, increasingly relevant in terms of sociology of health. So some universities call it medical sociology, some other universities call it sociology of health. Whatever it is called is sociology in health. It's sociology in medicine. And there are four fundamental areas, four fundamental concerns of medical sociology that you must know if you want to understand medical sociology and the professional role that medical sociologists play in the health system. Number 1, medical sociologists are interested in understanding how society, how social institutions affect health and people. How society and social institutions affect health and people and a population. So you have to know, there's a video I have on social institutions on this channel, so you can view it. Then again, number 2, medical sociologists want to understand patient relationships between patients as a category and medical officials as they operate, as they interact in the health system, whether in the hospital settings or non-hospital settings within health system, as they seek care. And this is important because this can determine health access, health seeking behavior, health outcome, and health service delivery. In fact, I have a video on this channel on health belief models. If you view that video, you understand what I'm saying particularly about this point too, looking at medical officers and medical officials and patients' relationship within healthcare system. This is very important, and medical sociologists also want to understand this so that they can be more efficient healthcare delivery and there can be more access. People are talking about behaviors of nurses, behavior of midwives, behavior of doctors, and how this affect people's health and health-seeking behavior. Number 3, medical sociologists also want to understand people's perception and behavior in relation to access to health, sickness, behavior, diseases, health, and healing. These are very important issues, attempts to understand people's perception, and behavior relative to sickness, relative to diseases, relative to health and healing. Even whether people, the sick row behavior, I will call it, or perception and worldview about sickness or disease, will also determine the health behavior of people or service delivery in terms of healthcare system. This is another thing we want to, all of these are very important. Number 4 is that medical sociologists want to understand healthcare facilities and systems and their distribution for efficiency, for effectiveness. Healthcare systems, facilities, and distributions, availabilities in a population, in a society, and how accessible and how functional they are. So this is within these 4 broad framework that medical sociologists operate and perform their role, professionally speaking. And they are very much interested in understanding health equalities or inequalities, the role of culture and health, the role of the health policies. Are they inhibitive? Are they prohibitive? Are they making healthcare more problematic? Or are they providing solutions? Looking at, like I've mentioned 3, and I've talked about health equalities or inequalities, culture and health, health policies and practices, access to health systems, or distributions or categorizations of health system in terms of modern health system or postmodern health system or orthodox system or traditional system. So what health systems do we have in a society, and how do we better understand their functionalities, and how do we understand the role of people in this and the role of this in people's health-seeking behavior? We look at childhood, demographics and health facilities, and we look at, for example, gender and health, childhood and health, gerontology, old age and health, youthhood and health, and a lot of clusters of issues. And we look at social psychiatry. Medical sociologists operate at the level of social psychiatry a lot. Even you talk about social welfare, in hospitals and the rest of it. I've had reasons to use these services before and provide a number of these services before. And in terms of particular professional work within the background of these levels that I've mentioned, I've been systematic about this. If you read my 2 previous videos that I mentioned, you will have seen definition of medical sociology, some other things about medical sociology. So this one is focused on the professional engagement. So I've given you the history of medical sociology. I've given you, clusters, 4 broad clusters of issues within which medical sociologists do their work. I've given you some other key issues or nodes which affect what medical sociologists do, of health inequalities or equalities, culture and health, and those stuff. Now, some particular work they do. So medical sociologists do a lot of research. Research is central to the work that medical sociologists do because they gather data, they analyze data to inform their interventions that they give within the healthcare system or even at the policy level. So research is key. As a medical sociologist, you will do a lot of research for organizations, for societies, for governments, for multilateral organizations. They also consult. Consultancy is very strong as part of the roles of medical sociologists. They consult for the World Health Organizations, UNICEF, United Nations, UN Women, UNDP, a lot, even governments of a lot of government operations across the world, both in developed countries and developing countries, or low and middle income economies or advanced economies. All of these, they consult for them. They also operate as public health officials. They also operate as social workers. They also work as lecturers. They work as lecturers in colleges and universities. They also work at the level of bioethics. Medical sociologists do a lot of bioethics in terms of their work, because they stand between biology, or medicine and humanities or social sciences. You see, so that's how you have bioethics. When you are looking at bioethics of professionals, medical sociologists are front, left, and center. So they are all over. They are very useful. Then they function at the level of hospitals. They work at hospitals, for example, as social psychiatrists, or social workers. They work in society and hospital also as social workers, as also social psychiatrists. Also, they work as policy advisors, policy developers, policy analysts for government across levels. They work at non-governmental organizations level across different. They play a huge role in that. They also operate at the level of health advocacy. They become advocates for health, inclusive health, access to efficient health, and the rest of that, access to healthcare and health distributions, and how we can manage society, social institutions in a way that gives access to health and more efficient healthcare provision, and also how we can better optimize relationships among patients and health officials, how we can make hospital environments more inclusive and functional rather than being dysfunctional. Also, they also play a lot of roles, in terms of understanding health behavior, health-seeking behavior, and palliative care, of terminally ill, the elderly, and the poor and the vulnerable, and the rest of all of this. And these roles keep evolving as societies continue to evolve. These roles also continue to evolve. And I think it's very important that we know that medical sociology is one of the strongest aspects of not only sociology, but social sciences and humanities. And I do sincerely recommend medical sociology for you because the opportunities are limitless. Till I see you in my next video, click subscribe to this channel, and bye for now.